Allogeneic transplant is now really a pivotal treatment modality in many adults with acute myeloid leukemia, but it remains associated with a significant risk of disease relapse, and that's the major cause of transplant failure. So there's increased interest now in the use of drugs to either prevent disease relapse, using them as maintenance therapy, or work to develop more effective salvage strategies for patients who do relapse. The two main classes of agents that are looking of interest in terms of preventing relapse as maintenance therapy are in patients who are transplanted for FLT3 positive acute myeloid leukemia, the use of FLT3 inhibitors such as gilteritinib or sorafenib. The jury's still out as to whether post-transplant maintenance with a FLT3 inhibitor in this population reduces relapse or improves survival. There's some retrospective data which is strongly supportive of this hypothesis, but what we need is appropriately powered large clinical trials. In the US, CTN Clinical Trials Network is delivering effectively a study of post-transplant gilteritinib. We hope that study is going to recruit in the next 12 months, and that's going to be really of pivotal importance. The other class of agents is the hypomethylating agents, typically azacitidine or decitabine, which have been postulated to augment a graft versus tumor effect by upregulating epigenetically silenced tumor antigens. So there's again some encouraging data to support the use of these agents, and recently with Marcos de Lima we completed a study using an oral version of azacitidine, CC486, which was well tolerated and mandated the randomized trial we'd just launched in the UK through the UK Impact Transplant Trials Network, a trial called Amadeus. 320 patients transplanted for AML and CR are going to be randomized either to receive CC486 for a year post-transplant or a placebo. Now, this is looking a very promising area for debate, for progress, but as always is the case, it's vital that we have prospective randomized studies before we can be confident that this is a practice-changing improvement.